We're going to stand. 1, 2, 3, and up. Well done.
A helping hand from his mum. 20-year-old Brett from Dundee has diaplegic cerebral palsy. He's unable to walk and has challenges with his sight and hearing. It's down to his mother Janice to provide around-the-clock care.
I didn't really realise there wouldn't be any other form of help for him, as in other services. He's always required help, certainly when he was younger. He was a lot easier to manage, he was lighter. For myself, it's just a daily challenge. Brett needs everything done for him from the minute he wakes up.
As soon as Brett left school, his specialist care stopped.
There is nothing in place, which was absolutely a biggest shock. Transition is supposed to come about 2 years before they leave school. We've had really very little in transition. Obviously, when COVID started, he left school very early in the March, and that's been it really. And we really haven't seen services at all. We had a couple of visits from physiotherapy with little or no hands-on at all.
It's the lack of hands-on care and physiotherapy that's also a problem for 69-year-old Jackie.
Before lockdown, I went to the gym. I was doing that to keep fit, but none of these things give me exercises to my legs. They're stiffer than I've ever, known, and the spasms are worse at night now. Do you know what I mean? Because people don't realise that when you've got constant spasms, it can be sore as well.
1 out of every 150 children born in Scotland will be diagnosed with cerebral palsy, and no two people with the condition will experience it in the same way. Now, experts and campaigners alike want more data to be gathered on the condition and for the decision makers to improve access to healthcare.
What we find so often is that people out with here present to services with an issue and they are told that is because of your cerebral palsy, there is nothing that can be done. Well, that's not always the case, and actually denying people access to services because they have a long-term condition is an abomination.
For Janice and Brett, the transition from child to adult care has left them feeling behind.
For me, it's quite a depressing phase, because where do we go? Is this going to be him just not getting anything now? I think there's no guidelines nor are there any pathways for him to follow as a young, and he's only 20. So is he going to just continually just be neglected? Because that's how we feel, a bit neglected.
The Scottish Government say they're committed to ensuring access to care and support for people with cerebral palsy. But for Janice and Brett, they have no option but to carry on. Vanessa Taff, STV News.
How's your shoes? All your slippers have come off.